New data reveals that in 2023, nearly 3 million children globally are either under-vaccinated or not vaccinated at all, compared to pre-pandemic levels in 2019. South Africa has, for the first time, been included in the global top 20 countries that have the most zero-dose children. This means South Africa has over 220,000 children that have not ever been vaccinated. Children that miss out on life-saving vaccines are left vulnerable to devastating and preventable diseases like measles and polio, for instance. Zero-dose children are also an indicator of wider inequalities in South African society. For more on the matter, we are now joined by UNICEF Regional Health Advisor for Eastern and Southern Africa, Dr. Paul Ngwakum. And he's going to talk to us about this issue. Thank you very, very much, Doctor, for being with us here to discuss an important issue.
Thanks very much for inviting me.
Very frightening to hear about these levels of very high unvaccinated children. I mean, zero vaccination. What does the stagnation highlight why more children were left out of critical vaccination drives for diseases such as diphtheria, tetanus, whooping cough last year? What happened?
Well, this is something that we've been struggling with, exacerbated by these challenges we got during the COVID pandemic, where there was a backslide in vaccination globally. The results that you just made mention of tells us globally nothing has changed in terms of vaccination coverage between 2022 and 2023. But in Africa and in Eastern and Southern Africa, we've observed some progress. Between 2022 and 2023, we've gained 4 percentage points in the vaccination for the first dose of what we call diphtheria, tetanus, and pertussis. We moved from 81% to 85%. But that said, the challenges still persist because we are not on track for the different targets that have been set globally, what we call the immunization agenda 2030 target. We are far away from getting there. And when children are unvaccinated, as you rightly say, you just said, it means there are chances and there are big risks of vaccine preventable disease outbreaks that are going to increase morbidity, mortality, and disrupt even further the services.
Yeah, and this is I know it's a global issue, it certainly is, but you know, when we look here in South Africa, because as I mentioned in the introduction, it's the first time, in fact, that South Africa is included in the top 20 countries that have the most zero-dose children. What are we looking at, if I can ask you for a few more details? I mean, what are the numbers saying and suggesting? Because I can imagine they're a lot bigger than what the numbers are saying.
Yes, I think you mentioned the number already. We're having 220,000 children in South Africa who are zero-dose. And the countries that are included in the first 20 are the countries with the highest number of zero-dose children. Even if you have 85% coverage and you have a high number of children that are eligible for vaccination, and you have a high number of unvaccinated, you are included in these 21st countries if you are part of the 20 highest numbers. But that said, this just tells us there are challenges.
Yeah.
There are challenges which some of them are specific for South Africa, but some of them are not specific only for South Africa. They are global, or they are for the region. Governments and partners, I'm talking about UNICEF, WHO, and Gavi, they know what to do. And what to do is, number one, we have to ensure that we have policies and strategies that help us to be able to work on primary health care and immunization. I'm talking about the national immunization strategies that are not only well done, context specific, but they are costed, and we know exactly how much money we need to be able to put in these interventions. The other thing is we have to work on systems. And you also did say, when we say children are not vaccinated, it's bigger than vaccination. It's talking about multiple inequities. We have to ensure that we have primary healthcare systems that are capable of taking care of all child illnesses, including immunization. This means communities are engaged, they participate. This means the platforms that we use to be able to implement these interventions are integrated. This means we know where these children are and we take the services to them, breaking the inequity gaps. So the design of the programs or the interventions have to be equity-based. And most of these children, we know where they are. They are in the urban slums, they are in the conflict-affected zones, and they are in the geographically hard-to-reach areas. We have to craft interventions that have to be able to reach them. But another thing is financing. We cannot be able to implement these interventions when we don't have the required funding. I'm talking about sustainable funding, domestic funding that is allocated respecting allocative and operational efficiencies, meaning the money is put where it is needed and it is used correctly.
And
all the issues that interrupt, let me just end in this point because it's very important.
Okay, go for it.
That interrupt vaccination is emergencies. We have to be prepared to respond on time on public health emergencies or other emergencies that are linked to climate change.
Yeah.
If we don't do that, we will keep on having unimmunized children.
And this, I mean, you really are. That is a very important issue when we talk about climate change. And I mean, the list of issues just goes on and on. I mean, we saw that over the last 5 years, measles outbreaks hit 103 countries. I mean, this is home to roughly 3/4 of the world's infants. This is a proper indication of the drop in immunizations that are taking place globally. I mean, this is, you know, these are very preventable illnesses that we have got these vaccines for. But what community drives are there? I mean, how do we get this out there into communities? Because we know when you are born in a hospital, it is, you know, the moment you sort of, the kid opens their eyes, they're already starting to get inoculated, whether it be tetanus or whatever the case may be. But what about in the much further out rural areas? How do you reach these individuals and ensure that they're vaccinated?
You're very right. Measles is a big challenge. And if you look back in history, 60% of under 5 deaths that were averted by vaccination was thanks to measles. And we have to really profit from this antigen that we have to protect the children. That said, every country has to have context-specific interventions to be able to reach these hard-to-reach children. This means there are proper situation analysis that identifies where are the unvaccinated children, not only for measles, but for other antigens, not only for immunization, but for other health interventions. They have to be able to make proper planning, what we call micro plans on how to reach these children. We need data, and this data should be used to be able to monitor and to be able to bring the proper actions and corrective actions to make sure that we are reaching the right children. And the health system must have possibility of supervising what is being done at lower levels. But above all, we are working within communities. We need community engagement, we need community participation, and ensure that we have what we call social behavior change that helps to ensure that we have few objectors to immunization or uptake to health services. But as I said before, bottom line, we need healthcare financing.
Yeah.
And this healthcare financing has to be sustainable. And for it to be sustainable, it has to be mostly domestic funding.
Yeah. Just finally, Doctor, very, very quickly, the one that really interests me as well is the HPV vaccine. It provides protection against cervical cancer, and this is one that is very, been trying to get a big push out there. And the whole goal is to reach 90% target to eliminate cervical cancer as a public health problem. Where are you in this? Is there an uptake on this one?
I think in all vaccines there are challenges. But in HPV, human papilloma virus specifically, I must say we've actually moved forward in Eastern and Southern Africa. Globally, from the documents or the records that you have, 27% of girls below 15 years have been reached. But in Eastern and Southern Africa, we moved from 49 to 58% as per the data you have. This means efforts are being made. This means it is possible when there is leadership, when there is real partnership among the different stakeholders. And this progress we've made is thanks to the different partners, government on the driver's seat, but support from UNICEF, WHO, and also Gavi, whereby there has been resources put to be able to introduce this vaccine and also revitalize. But that said, we are not yet there. We need 90% coverage to be able to have a kind of a proper protection of these, the community, the ladies in the community against HPV, against cervical cancer. And we are still moving on, and I think we're going to get there.
Doctor, thank you. Thanks for talking to us. I know there's a lot more to talk about. Dr. Paul Ngwakum, who is the UNICEF Regional Health Advisor for Eastern and Southern Africa, speaking about new data by UN agencies that show that immunization covering for children worldwide stalled during 2023. And that is where we have to leave the show.